This is NBC6 South Florida Today.
Welcome back. Lipotherme is the latest method for removing fat by laser. But what it really makes this cosmetic procedure so attractive is that, unlike traditional liposuction, you can shave off those fatty areas. Then, I've heard, you go back to work the next day. Joining us is Dr. Jason Shapiro, and he's going to tell us how this works. This is phenomenal.
Well, thank you very much for having me on the show.
It's a pleasure to see you. So this is a laser.
Absolutely. This is a diode laser from a company called Lipotherme. It's out of Europe. And this device is a little different from traditional liposuction.
Okay.
I'm able to use this very small cannula that, when inserted through the skin, I'm able to apply the heat of a laser to actually liquefy the fat tissue.
Wow.
And remove the fat very gently, as opposed to traditional liposuction.
So then where does the fat go?
We actually remove it, and it's collected and removed actually from the treatment area.
Oh, interesting. Okay. And so you really can go back to work the next day?
Absolutely. You know, this entire procedure is done under local anesthesia. So once I've achieved a good anesthetic area and we've applied the heat of the laser with this device, we're able to very safely and efficiently remove the fat tissue while the patient's completely awake, talking to me throughout the procedure.
Okay. How much does it cost?
Depending on the treatment area, but it's traditional this is a third the price of traditional liposuction.
Really?
Absolutely.
Wow. Now, do you have any holes or anything afterwards?
That's a good question. The incisions are so small that it leaves virtually no scar, if any scar whatsoever.
Phenomenal. Now, and it's FDA approved and everything?
Absolutely. This device actually has been used in Europe for the past 10 years.
Wow, why are we so late to the party?
You know, absolutely, I agree with you. And it's been approved by the FDA over the past 2 years, and I'm using it in my practice in South Florida.
What's been the response from people who've gotten it?
You know, remarkably very happy instantly. Within a day or two after the procedure, they're surprised to see very minimal bruising, virtually no scarring, and the ability to go back to work with any downtime. Everyone's happy with that.
Does it hurt, though?
Virtually no pain, maybe some discomfort during the procedure, but it's a very tolerable procedure versus the traditional liposuction.
Gotcha. Is there anyone who shouldn't have it?
You know, people that are morbidly obese with BMIs or body mass indexes that are over 36, I would say this procedure isn't for you. But for the average person, this is the perfect procedure for removing love handles, maybe excess fat under the skin, under the chin, or fat within under the arms, so on and so forth.
Okay, why'd you look at me when you said fat under the arms? Okay, so any body part for the most part then?
Pretty much. I've personally seen outstanding results with doing this procedure for removing fat underneath the chin,
okay,
inner and outer thighs, upper and lower abdomen, the back, as well as the area right below the bra strap. We've really seen fantastic results. Now,
does this totally replace the old, or are there some cases where you need to do the old kind of liposuction?
Well, you know, it's all in patient selection.
Okay.
Patients that are more appropriate for liposuction, those are patients that are typically very overweight. Those are patients that we do not select for this procedure.
Okay, gotcha. Okay, so you could take me from a size 8 to a 4, like in a day?
That's the plan.
Oh, I may not be here next week. No, but you say there's no downtime.
Absolutely, virtually no downtime. If you had to go back to work the same day, you could. I'd recommend take the day off and relax, and by next morning, 6, 7 o'clock, you're ready to go.
Any hazards whatsoever?
Hazards? How?
Like, you know, side effects or anything like that?
It's a good question. Really, because we're able to use, you know, the addition of a high-intensity laser, it takes a lot of the trauma from traditional liposuction out of the procedure. So just using a laser, I'm able to liquefy the fat tissue, making fat condensed into a liquid state that's very easy to remove, versus traditional liposuction that would require a lot more effort and more trauma in the body.
Wow.
So using this, we're able to cause less bruising, less discomfort, and so overall, we're very pleased with the procedure.
Oh, thank you so much, Doctor. I think a lot of people are going to be pleased. I think your phone's going to be ringing.
Thank you for your time.
Thank you. Dr. Shapiro's practice is located at 1425 South Andrews Avenue. That's in Fort Lauderdale. For more information, you can give him a call directly at 954-760-4370. Now, you might have to beat me to the phone, though.